See you guys. What's happening?
Real quick, I think everyone knows Jon Stewart,
Hello.
right? Everybody's favorite comedian, most well known from The Daily Show, all those good times, and many other entertainment segments. So, hey, this is great to have you join us today.
Thank you so much. I apologize. You know, I've been in quarantine, so now I look like Albert Einstein. But we're having fun. I just wanted to stop by and say hello and thank you guys for all the good work you're doing and trying to stay safe and sane during this crazy time. Wanted to shout out my friend Colonel Harbaugh. I saw he was on there. Colonel Harbaugh's a good man and could use all the golf instruction he can get.
Absolutely.
So I think it's important that he be on this call and any other call that helps with golf, because he's terrible. He's just terrible. And he needs the help. But you got a great program going on down there. It looks beautiful in Kennesaw, Georgia today, by the way.
Yeah.
I hear the birds singing. I'm in New York, so all our birds are dead. But it's good to hear it in Georgia, where it's actually, and I'm as you can tell, I'm in my kids' playroom, so we're getting that done. But you know, to all the VAs out there and all the people, you know, that are doing the support for our men and women, boy, we can't thank you enough. And the great work that you're doing and the hard work that you're doing, it's just so much appreciated. So thank you guys so much for everything that you're doing.
Fantastic. Really appreciate you chiming in. I know you've had some great involvement with the Warrior Games.
Yes, sir. We've done the Warrior Games now. I've hosted now for the past, I think, 5 years. And we did it in Tampa, the last one, which was the best one by far. You know, they keep getting better. It's a great experience, adaptive sports for veterans that have been wounded, invisible wounds and otherwise. We've seen it just turn people's lives around. Like I think the Warrior Games and adaptive sports literally saves lives. It's an incredible experience. Every branch sends a team. Colonel Harbaugh ran the games in Tampa last year and did just an absolutely phenomenal job. I mean, honestly, it was the best games that have been put on by far. SOCOM did an incredible job. The Marines have it this year. It's going to be in San Antonio. At least I hope they're having it. You know, obviously with the conditions on the ground with this COVID, I don't know if we'll be able to do it. But hopefully we'll get back to doing it as soon as we possibly can. It's just a tremendous experience. And if you ever get a chance to go down and watch some of the athletes, you'll be blown away. The competition's phenomenal.
Hey, John, I
To that, and
don't know if you can hear me.
Colonel, yes. Can you elaborate on what might be the outcome for San Antonio?
Yeah.
Yeah, it's sounding like it's going to be a postponement. I mean, I think it's an absolute necessity unless this stuff clears and we don't have people at risk. So we may have to be pushing into 2021. They had to do the same thing with the Invictus Games that were scheduled for The Hague. But you know what? The spirits are still high. What you're doing here with these recreational therapies and this venue itself, with golf, which is thankfully one of the sports that you can do with social distance and continue to get the vets and wounded warriors out there to not only exercise but recover and rehabilitate. A phenomenal game, which is why I'm involved now and the chairman of the Special Operations Warrior Golf Foundation, which is more about just not using the venue of golf but getting the guys connected. That's the most important part, allowing the healing to happen with the focus and concentration of the game, but also the connection to others, as well as the connection to resources, because we pull in a lot of folks. One thing, too, that I'd like to highlight on John's involvement, which goes well beyond Warrior Games, is all his efforts. Most of you are familiar with what he did with the 9/11 first responders and their exposures and them dealing with the illnesses that they were dealing with. He's done the same thing on the veteran front. I've been involved with him for the past few months. We've had to stall it again due to COVID to some degree. But the fact is that he's also working on behalf of all of us out there that have worn the cloth of the nation, that have been on battlefields and sucked in whatever we sucked in that's also making us sick. And we got a lot of veterans that are getting cancers at too young an age. And Jon is on the vanguard using his stature, celebrity, intelligence, and connections to help move legislation that'll hopefully help us all.
We're going to get it done, Colonel. You know, we're still moving forward with it. It's been slowed down a bit, but we're going to gather together again. I think we've got a forum that we're doing to reboot our effort in the middle of June, and then we're going to reboot our efforts at trying to lobby Capitol Hill. Obviously, it's a little more difficult, but Colonel Harbaugh's been down in D.C. with us. We've been in the planning stages with veterans from Vietnam War on up through Afghanistan and even Syria and some other areas. So we're still pushing hard, but you know, this COVID, if you're at risk because of exposures for respiratory ailments from the get-go, well, this COVID thing is doubly difficult. And so the urgency is there, and we're just going to keep pushing to make sure that we can get this thing done. It's a little tougher right now, but you know, you guys are nothing but resilient, and you know, whatever obstacle they throw in front, we'll push past it, and we'll keep going.
Yeah, thanks, Jon. I mean, we just lost a Medal of Honor recipient to lung cancer, 42 years old, with 2 small kids. Ron Scher, a great guy, great friend, obviously, special operations community member. And, you know, to be losing such phenomenal people at such a young age, it's just unacceptable. We have to continue to push this, and we don't need the system fighting us on whether or not they need care. Right. And I know that's very much at the heart and soul of what you're trying to do. Much appreciated, brother.
No, my pleasure, brother. Always got your 6, and we're going to keep going. The gentleman you discussed was working with our Burn Pit 360 group, run by Rosie Torres out of San Antonio. So we'll, you know, as you guys know down there, DC can be a little frustrating in trying to get something done for you guys, but you know, we'll get it done. We'll keep pushing.
Well, to the both of you, your efforts, that's what really speaks volume, as well as so many others here in the call. So before we let you go, and before we let you get to that strategy board behind you, just one quick question. Just one burning question. Of course, you know, I'm the one with the Zoom account, so maybe I get the one question.
Yeah.
At any point, was there any hiccup with New York pizzeria deliveries up there?
Let me tell you something. To go this long without being able to go to a New York pizza, you know, this has been the toughest thing. And they don't talk about it enough on the news, the difficulty we've had getting our delicious pizzas. I'll be honest with you, I've been so desperate, I've been popping in DiGiorno's. I've been popping in the frozen pizzas. So
oh no.
It's, I don't want to tell you my tale of woe, but frozen pizza, not good.
All right, good stuff. This has been a great treat. Thank you so much, sir.
No, my pleasure, guys. And keep going there. Keep having fun with that golf. And seriously, help the Colonel out, because any putt beyond, I'd say 2 to 6 inches.
Oh, funny.
Both a blessing and a curse.
Yeah. See you guys.
All right.
Take care. Thanks, Jon.
All right, that was fun.
That was amazing, Dave. Thank you. And Colonel Harbaugh.
Fun. Oh, thanks the Colonel.
Yeah, absolutely. Thank you all. Appreciate it. That was great.
He reached out, and we thought we'd have a little fun with that. So stay tuned for our June segment. I think we have another pretty cool surprise coming up sometime in June on one of these Fridays as well. I think we're going to start with Keith inside the Tampa VA. And as we've done since the end of March, myself, David Windsor, joined by Bob Biroscak, our lead adaptive golf coach with Tampa, PGA Professional there. And we're just continuing to do what we can to provide some instruction and keep everybody motivated for when we get back out to our in-person clinics. But I'll take Keith. Keith is there in the blue. And I'm clicking unmute here for you. How about we do an audio check with you, Keith?
All right, gotcha. There is a slight delay, but I got you.
Very good. Tell us what you have set up there, and what you and Bob. I'm gonna
Well,
my co-host Bob Biroscak.
we have our typical putting green, followed on by our chipping mat. The variation between regular golf balls and wiffle balls, depending on what we're doing, as we're chipping into the screen and the camera. We have already stretched during the call with Jon Stewart, which we appreciate. And we started by a deep, relaxing breathing. So we didn't get into the other topic that you and I have discussed earlier this week, but we did start implementing the relaxation of the deep breathing, kind of like a yoga stretch. And so far, it's worked pretty good. So when we do that, we want to kind of inhale through the nose, feel it down around your belly button. Pause for a moment and exhale, and just kind of let the stress of the day just kind of melt through your fingertips. You acknowledge where you're at, kind of feel your toes a little better, and get a good mental perspective for the lesson to come. So, go ahead, Dave.
No, that's great. That and what we did is we did learn a little bit. There's a video up on our YouTube channel, the Adaptive Golf Academy. My very first one. I embarked on becoming a YouTuber just this week. It happens to be a health and wellness segment from our doctor of physical therapy, and he really talks about, we get a chance to demonstrate the difference between stretching and warming up, and how he's taught me so much that there is such a distinct difference to warm up those muscle groups to really maximize the rotational movement that you need in the golf swing. So you guys can check that out. But what we were talking about was doing some of the, just the mental relaxation, even getting into your own self-meditation, just to get you in the right spot in the present for the golf swing. So I'm going to look up a couple balance things here. Bob and I were talking, and we try to match it up with those who you may have there with you to begin with, to kind of draw an example. And looks like you said you had a participant there.
Tom, I have Chris.
Okay, great. So Bob, you want to help get Tom up. Is Tom ready to go first? We're somewhat familiar with Tom. I know we're working through some balance, and then I'm going to come up with a little video to sort of overlay with Tom. You good, Bob?
Yeah, I'm fine. Good morning, Keith. If we'll put a club in Tom's hand, please.
Okay. Are we putting? Or
No. I want to do something a little different with this, please.
All right.
Okay. Did Catherine get the wedges, the door stops?
Yes, we got them.
Good girl, man. Good girl. All right, now, what we need to do is, I'm concerned somewhat with Tom's balance, okay? And I talked to David at length about this, and it's the fact that I want Tom to feel safe, comfortable, and not have to worry when he transfers his weight, Keith. So,
okay.
For more stability, if you wouldn't mind, I need Tom to get his feet fairly wide to the outside, the inside of his feet to the outside of his shoulders.
Okay, ready?
Keith,
Yes.
can you, I don't know, can you see can you see what I'm doing here? I want the inside of his feet to the outside of his shoulders. That's how wide.
Yeah. Okay.
Okay, great. All right, now, what I'd like you to do is to take that rubber wedge, and I'd like you to put it on the outside middle of his right foot.
This is going to be uncomfortable. Right?
Okay, so Tom, roll your foot a little bit to, that's right. Roll your foot to the inside a little bit. There you go. And if you could wedge that. Now, guys, with people with balance problems, especially like Tom, this can give him more stability. You can practice this way, Tom. This can give you a lot more stability when you swing a golf club or when you're practicing, so whether you're on the driving range or here or anything else. Now, what I need you to do with Keith's help, please, is to, all right, I want you to grip the club.
Probably not yet. Okay, that's fine. Say
Say
again?
I'd like him to grip the club, please, and get in his posture. I know it probably feels a little uncomfortable, Tom, with that right foot. Now, what I'd like you to do, okay, good. Now, with Keith's help, if you wouldn't mind, Keith, turn him as much as he can without any pain or problems into a backswing. Okay. Now, I'm going to ask you one big thing, and if you don't feel comfortable with it, Tom, I don't want you to do it. Can you lift your left heel just a little? Perfect. Now, do you still feel stable on that right side because of that wedge is there?
It's all right. I'm not sure.
Okay, good. Okay, now, what I want you to do is I want you to follow through, hit an imaginary ball, and then transfer your weight to the left. That's it. If you can, transfer your weight to the left side. Feel a little unstable? See, what that wedge is doing for you, Tom, is it's keeping your weight inside on that right foot, and now it's transferring your weight to the left side. And that's something that I think we can work on, or you can work on without a golf ball. Good, really good. You can work on it in the yard, in here in the atrium of the hospital or something. But this is going to really help you with your golf swing, because right now, if we had tapes of this, we could see that in the past, you have not been able to turn your leg, turn your hips very much, and you had more of an arm swing, which is good. But now we're trying to introduce your body more into the golf swing. So that's why the wedge is there. And when you turn, this gives you the ability to turn more and to feel a little bit safer.
Okay.
Okay. All right. Now, that being said, Keith, let's see if he can hit some golf balls with that wedge underneath his foot.
You ready? Yeah.
Okay, posture's good. All right, hands a little bit further away from your thighs. Good, that's great. Okay.
There we go.
Good.
Hey. That's okay.
Gotta love the camera view. Very good.
Good.
Yeah.
Much better. Way to go. Good job.
Yeah.
You didn't see David right in the forehead of our camera angle.
Well, look, I have this one piece that may help with that pivot, right? So you want to encourage that pivot. You want to get that muscle group of his torso, moving properly. This should cue you up. I just want to point out here's a gentleman. He has a T6 injury, which has, and this is that health and wellness segment that I noted earlier on YouTube. And just kind of going back to it, this is what's come to mind, where right now he has it on his shoulders with a resistance band and just like a little clasp hook on the end of an iron. I believe it was his 8-iron. So here, things to do to warm up prior to if you want to just see it in motion, hopefully it doesn't jump too much on your end, to clear up. But providing that resistance to the golf cart, or providing a resistance band to something else stationary inside. I know you have the resources there, and most of us have access to these. Here he switches. So then, is this where he would be feeling it? So he switches the shoulders, and then he goes and he moves them down to the hips. And I'm not claiming to be a medical advisor, but I think we have someone on here that would be even more helpful. I know I saw a good friend, Steve Giamona from Paris Island Adaptive Golf Experience, and he's also a physical therapist that could also comment on this right here. And building that resistance is just helping him maintain that turn. I think he gets it to his waist. Here we go, right to his belt line. And even by repositioning his feet slightly and just feeling that turn to whatever limit is comfortable, right? You never want to have a student feel pain, but the student here working, he never hits balls. He's just not a range rat. That's the last thing he can do because he tires so easily. Being out on the golf course, hitting a shot, then getting in a cart, having that rest time before the next shot, that's his forte. But he gave testament that after doing these warm-ups, not stretches, but just warm-ups, engaging those muscles, he hit a half a bucket of balls and felt the best he's ever felt. So I just wanted to share that piece right there. I don't know if I can get it to stop playing on my end.
Hey, David.
Start mimicking the golf swing.
Perfect. That's what we're kind of working on with our balance. Okay, so it's stable, just like they were showing in the video. Feel it, back, and forth. And you feel it naturally, just allowing your trunk to turn, the weight shift. Okay. I'm sorry.
No, you're good. You're good. You're really good, Keith. That's great.
Maybe a possible example that we've seen more of, maybe some of us have caught ourselves at some point with a swing similar to this. And again, sort of in the theme of our balance, we're sort of hitting home on some common characteristics. Now, just besides the fact that he is, left leg amputee, it could be anyone with just any back issue or balance issue, and you'll see this the characteristic of his finish, right? So from an amputee component, we talk about, hey, how do you trust the turn to the post to finish taller on his left side? But you can just see a common thing for any player could be falling back, right? And that just can be pretty detrimental anywhere in the lower back, hip, things like that. So then how do we get that and make a change? Something that we present would be such as a week later after working through with a Believe It board, our Lexon polycarbonate board, working with an iron, really feeling the descending angle of the club, and those working with a shorter club is helpful. And we can get to this scenario. Where's that little bit of a step in, takes a lot of pressure off the lower back, and he's keeping that momentum going forward towards the target, right? So with some repetition, a little delay, but it's that step in. You just have to let the ego go that you're not going to finish in that perfect PGA Tour silhouette logo look-alike every time. But if you can institute something like that little step in, Gary Player did it. You can argue with that all day long. So it was just
9 major championships.
Yeah, there you go. Hey, I hear Doug MacArthur on the line there.
Hey, buddy.
All right, pal.
Welcome home, brothers and sisters. Bless you.
Yeah, Doug, he's now a resident of good old Dublin, Georgia, just outside of Macon, and we're going to be talking after the holiday. We're going to get that. We're going to get our PGA Hope program going down there, as well as our other adaptive golf. So we got the green light. So it's pedal to the metal.
Love it.
So showing those examples there, right? I don't know, because where everybody's at, and Bob, you always ask the question, hey, if you're comfortable in doing this, and you're asking Tom to maybe do a little step in, maybe that's something to work with. But we know everybody's at a different level, so that's where we just begin with small adjustments.
That's right.
Okay, get it back to you, Bob, and Keith and Tom.
Keith, need to ask you a favor. Would you get in front of, I'm just opposite from where you're at. Now, don't worry about the wedge. Don't worry about the wedge, okay? And what I need you to do is to get down, basically on your knees, right about where he would hit the ball to.
Where he would hit it to.
Right in front of him. He's not going to hit a ball, directly in front of him. There you go. Okay. Now, what I need you to do actually is put the ball back. Tom, put the golf club in front of the ball, please. All right, now, Keith, put your hand down there close to the about a foot, maybe 18 inches in front of the ball. There you go. Now, what I want you to do is, you can actually put your left hand there. Whatever, there you go. Now, Tom, if you will try and put the golf club in his hand. Good. Now, Tom, look at your arms, hands. Look at your arms, hands. You see the triangle? That's where you need to be. Those hands, your hands have not broken that. That's where I want you to be. That's where I need you to be. In other words, put the golf club in a mitt. Put the golf club in Keith's hands. When you swing the golf club, that's what you want to do, is put it in his hand. All right, Keith, let's get you out of there. And let's see if he can do that, okay?
Whew, okay, good. I thought this was going to be part of some take from the Todd Kierstead show for a minute.
All right. Now, put it in his mitt. Not bad. Not bad at all.
Hey, Dave, I think this would be a good time for that in-between shot breathing. Just because I can kind of tell. If you want to elaborate a little more before you give me that good deep breath in. Blow it out. Okay? It's just you and the ball. Just you and the ball. Tell me if it looks better. Good. I've been working on it all week. Honest to God, I have. So I know that it works, even especially when you get frustrated with shots like this.
Better. Good shot. Good done.
That was coming right at me that time.
Yeah, I think he got you, David.
Yeah. No, I think, even keeping his chin up, possibly, he would feel a little better posture, standing a little taller.
Yeah, I was thinking about that, but I think the mask has something to do with it, David. But I agree with you.
Yeah, good point. But what Keith is looking at is just kind of everybody being mindful. When they go to the range, a lot of folks are getting back out, and I'm seeing that they're really firing through a bucket of balls, and it just becomes more of a workout than practice, right? For lack of better term. So that's where you just have to take your time and take those breaths in between, because when you're on the golf course, you have time to reflect and think about the next shot and keep things moving forward. But sometimes you just get caught up. So quality over quantity on the practice range. Oh boy.
Okay.
All right, so do we want to work, who else?
Who do we have next there, Keith?
Edge 7 irons, probably not. You want the mitt technique used again?
No, let's see what his swing looks like right now, okay?
All right.
Okay, let's get his hands up. Let's get his better posture in his back a little bit. There we go. A little bit more upright, please. Keith, we need his hands a little bit farther away from his thighs, please.
I think that's pretty good for his stance. Okay, we're gonna swing it.
Actually, no, Keith. He's still bent over too much.
Right. Okay. I have an idea. Okay, follow me on this. Okay, good. Okay, I'm gonna get my golf swing stance. Okay, and listen to that. Breathe it in. Relax it out. Okay, you don't have to bend.
Right there.
See?
Whoa, perfect. Don't let him get, that's it. That's where we need him as far as his posture.
Okay. I can do
Good.
this. Okay. You breathe it in, relax it out, and you're in a good posture stance. Okay.
Good. Okay. Now, Keith, can he go a little bit higher in the backswing?
Go ahead. Hey, give me, okay, say there's a ball here, give me one, just good swing. Okay, go ahead.
Okay.
All right.
That's fine. We don't need to swing quite that hard, but that's fine. All right.
Okay. That wristy thing is going to get you every time. Right? Maintain that nice firm triangle. Okay. And let you trouble. Take care. Okay. Much better.
Excellent. That was super. Really good. I love it. I love it.
So I know the conditions there are a little different. You know, you have the mat, but just one thing I might have picked up on is, you know, his left arm, his left elbow. It might be bending a little bit, kind of pulling in at impact. So just with some practice swings, right? Just to hold the club with just the left hand and take your right arm and, you know, hold your bicep, right, or tricep, and just kind of do some swings, feeling that extension coming through and sweeping the mat. If you see just a little bit more back and just kind of hitting through here. And that just might just get that left arm to feel more extended through there. I can't quite see the launch of the golf balls. It looks like maybe they're coming in a little low, like he might be, you know, pulling up with that arm. But that should provide a good sensory. There you go. Nice.
Good. Good. Good job.
All right. Well, yeah, I'll let you guys complete another.
All right, let's put the other hand on, okay, Keith?
Okay.
You know what I really like is his grip.
Come towards me. There we go.
Good.
Can I see this? Just take your grip, lift it up so I can see. There we go. Relax. All right, that's much better than once. Gotcha. Something else that happened just slide this thing that way. So you're over the ball, right? Here you go. Much better. Okay. Better.
Okay. Keith?
Yes, sir.
All right, let me just show you this a little bit, and you know, you're going to need to help to work with him. When he's swinging the golf club, I'll show you from this angle. He's bringing it in here good enough, but as he comes through, okay, his left hand stops, his right hand takes control, and just like David was saying, the golf club ends up right over here. Okay.
Okay.
If you want to pin my video.
I'm doing that.
Okay. Ladies and gentlemen, if you go to the right, top right-hand side of your screen, and it'll have a pop down, and you can just pin the video. Okay. So what I'm trying to get across is this. Okay. He moved his golf club in a pretty good position here, but as he came through, basically this left hand stopped and the right hand took control and he was over here. Even though he extended a little bit, but it was right here. When we work with people, especially at Temple Terrace or at Terrace Hill, I usually try and stand out in front of them without a golf ball, quite naturally. And I try and get them to swing the golf club to Bob. So the golf club has to come straight out to the target and not around. As you see what happens right here, this left wrist, left hand, it cups or it supinates into this position. And this is exactly what David was trying to express also by holding this left bicep to get that arm to go out without breaking of the wrist. This is what you want to try and feel in this position as opposed to moving that wrist. We try and maintain this triangle during the hitting area. So as you go away from the golf ball, you're here, you come back to the original position almost when you hit the golf ball, and then you maintain this triangle all the way out into here, as opposed to moving this way. This is trying to scoop the ball. You know, I love visual analogies, so to speak. I'm real big on them. I try and get people to see things in a different manner. In other words, he's got a half gallon of ice cream and he's standing on the counter and he's just scooping it. Okay? We want him to pick up peas with a fork. Okay? Bad example, but just think of it that way. You don't want your swing to look like this. You want your swing to look like that. Okay? So let's try, I'm gonna pin his video again.
Hey, may I ask Keith? Keith, did you want to set aside a minute to drop down to Spinal Cord and say hi to the group?
Sure, if you'd like.
Okay, you say when. I didn't want to cut you short as we're coming up on the hour.
I really want Chris here to end on a positive note. So he's been practicing a little bit during the discussion, so I want him to get two good shots up over the monitor.
Much better. Much better.
There we go. Hey.
Sounds
All
good.
right.
Well
All right,
done.
excellent.
Well done. Good job. David, I just wanted to do a little shout out to our good friend Todd Kierstead up in Canada. And ladies and gentlemen, a lot of you don't realize how excellent a trick shot artist Todd is. We got the opportunity to see him at Terrace Hill. He's a big hockey fan also. I guess you would know that living in Canada. But I have to tell you people, I saw him do this twice and I am still shaking about it. Todd, you are one of the most unbelievable trick shot artists, and I've seen quite a few that I've ever seen. And my hat is totally off to you. Thank you so much for coming in and giving a little presentation to the people here at or when we had our clinics at Terrace Hill. Thank you, Todd.
No, you know what? Terrace Hill is near and dear to my heart. David Windsor, all the guys on the call right now. I've been traveling around the world for the last 18 years doing trick shots and raising a lot of money for different charities. And it wasn't until meeting David and doing a demonstration at Terrace Hills that I realized that a lot of the shots I was doing for pure entertainment value, it was actually emulating the situations that a lot of the guys were in attendance. So it opened my mind to adaptive golf, and I've had the privilege of being part of the Invictus Games when it was in Toronto, because that's where I'm in 2017. Spent a lot of time with Colonel Harbaugh playing golf, and now proud to be a part of the Special Operation Warrior group that he's running there. And it's near and dear to my heart. I didn't serve in the military, but it's my way of giving back and saying thank you. Hopefully putting a smile on somebody's face and giving somebody the opportunity to hit a golf ball where they might not have thought they could ever do it again. So thank you so much for everything that you guys do.
Hey, thanks, Todd. Let me see if this will play. This was last November when we got together for our training workshop, and this was moments before we headed over to a Tampa Bay Lightning game, right?
In a row, ready. Oh my goodness! Oh my! Oh!
You can hear Charlene.
No. My job. All right.
Now, Todd Wes wasn't able to make it. He had, well, he had a honeydew list, put it that way today, but so he couldn't join our call. But you have another video that you pieced together. He hit 3 shots like that. I mean, we know you can do it. We've seen you a number of times. Those of us that have seen it, maybe this one would also show up.
Wow! Oh, that sounded terrific. And it looked wow. Nicely done.
Did those show?
Yeah, you know what,
David.
To me, it's all to do with the work that you guys have been doing with David down there. I just basically told him to close his eyes and swing as hard as he can, and I'll put the ball right in his sweet spot, and that's what happened.
Yeah, so
I like Todd's comment afterwards. He says, "I think I have competition."
That's right. That's right. So yeah, let's see if you can give me that video once again. Maybe it's on your Facebook page of Wes hitting those shots. That was terrific, and we'll have that ready to queue up next time, because that was just drawing from my Google photo album. So sometimes it'll jump a little bit. So that's great.
Thank you so much for having me on, and it's great what you guys are continuing doing during these crazy times.
All right. Well, I thought that was a great treat. Didn't have to send a second note to Mr. Jon Stewart when we asked, hey, look, it's just something that we've been doing, interested to pop in and give thanks to those that have kept our veterans and service members safe. And that's our VA frontline staff all across the country. I mean, I've only heard just fantastic things of, the health and, the hospital staying safe and away from the COVID stuff. So hats off to them first and foremost with everything happening. Hey, this is great. Thanks for stepping up, Keith, and, keeping it consistent and going through all the equipment for us every week.
Thank you. thanks for providing this and letting us all really appreciate it.
All right, got it. Well, this has been great. Thanks so much.
Thanks, guys.
Based
Now,
on,
no class, no meeting next week.
yeah, so yeah, good point. Thanks for bringing that up. Just quick blip, and I can remind everybody by email, those of you that registered. So no meeting next week. But Keith, you we'll summons you to keep the activity going, and then look for the email invite for June. So we'll have all 4 Fridays in June mapped out and have some more special guests planned possibly. All right, everybody have a wonderful Memorial Weekend. We all know to take a minute and pause for what it's all about.
And
All
be
right.
safe.
Everybody be safe. Thank you.
All right, take care.
All right.
Bye-bye.
Everybody. Bye.
Bye.